So ma'am, we are live now. Hello and welcome to I'm the Best Mom. I trust you all are keeping well and staying safe. I'm the Best Mom is committed to make the motherhood a joyful experience, and collective knowledge and right information from the specialized doctors and experts does matter. And Cover Pace Cover Story comes with the answer and a lot of solution to your life. Now, our child is very precious, and every time when we are going through a challenge time, it's very important to understand how a doctor thinks and how you think. And we always carry a butterfly effect because every life is precious. Now, child's good appetite, which is always a concern of every mother. Child's good appetite helps in better physical as well as a mental growth and development. However, if the child has a nutritional anemia, the body will be unable to absorb the essential nutrients like iron, protein, vitamins, and other minerals. So in this special edition of Cover Pace Cover Story, we have been discussing many factors, many subjects which are of great interest to you. And we are so thankful to you for your continuous queries, concerns, which we could resolve. Today, we have Dr. Palash Das in conversation with Dr. Anuj Rastogi sir. And ma'am will be taking on how to turn your child with glowing cheek and good appetite. Dr. Palash Das comes, she's a pediatric hemato-oncologist at Kalinga Institute of Medical Science and pretty well experienced in the domain. Before we get into the discussion for the day, I would also like to share a very basic fact. Sometimes we believe yes, we are doing absolutely right. Now, I believe everybody can see my screen. Now, take an example of iron content from rice bran. Per 100 gram, we are getting 35. Soya chunks, around 20 mg. Fennel seeds, around 18. Radish leaves, 18 mg in 100 grams. Jaggery, 10 milligram. Likewise, in various food source, but we get the kind of content we get from as the nutrients of iron is minimal. So today we are going to have a lot of knowledge from both the experts, and Dr. Anuj sir will be taking your questions, his own experience of life dealing with so many children, and a lot of questions from the mothers. And I would also request, please go through the session. If you have any specific question, please let us have it on the Q&A. We will be taking it at the end of the session. Over to you, Dr. Anuj sir.
Thank you, Deepmani. Thank you. Good evening, friend. आज हम बच्चों की एपेटाइट और उनके कलर के बारे में बात करेंगे। जो मैं पहले बच्चे देखता था, जब हम धूप में खेलते हुए आते थे तो हमारे सबके गाल बिल्कुल लाल लाल हो जाते थे। तो बहुत लोग देख के कहते थे कि लाल टमाटर की तरह बच्चों के गाल हैं। बट नाउ दिस हैज चेंज्ड, maybe because of junk food, maybe over reliance on the milk. Junk food is the best bad killer for the iron absorption. अब आज अगर मेरे पास कोई बच्चा आए और उसके पास मुझे बोला जाए कि सिर्फ एक टेस्ट करना है इस बच्चे की वेलबींग के लिए, तो मेरे लिए सबसे इम्पोर्टेंट टेस्ट होगा हीमोग्लोबिन। इन केस अगर मुझे थोड़ी फ्रीडम और मिलेगी तो मैं पूरा कंप्लीट सीबीसी या हीमोग्राम कराऊंगा। हीमोग्लोबिन इज सो वाइटल। अगर आप टेक्निकली देखें कि हीमोग्लोबिन से हमें इतनी इंफॉर्मेशन मिलती है बॉडी की, जबकि आप लोगों का ध्यान हमेशा ईएसआर की तरफ जाता है कि ईएसआर कितना है। मैंने किसी पेरेंट को हीमोग्लोबिन के लिए बहुत वरीड नहीं देखा, बट एज ए डॉक्टर मेरे लिए जो सबसे इंपॉर्टेंट है वो हीमोग्लोबिन है, और सीरियल हीमोग्लोबिन। मान लो 5 मंथ पहले आपका 12 था और अब आपका 8 रह गया, तो इट मीन्स या तो बनना बंद हो गया या लॉस होने लगा। और वो आपकी एपेटाइट पे, आपकी कॉग्निशन पे, आपके वेलबींग पे, जो आप कमजोरी महसूस करते हो, हर चीज पे हीमोग्लोबिन का इफेक्ट है। हीमोग्लोबिन का जो मोस्ट कॉमन कारण है वो न्यूट्रिशनल है। सो दिस कुड बी न्यूट्रिशनल एनीमिया, और दिस कुड बी समथिंग एल्स। कहीं आपको ब्लड लॉस हो रहा है, स्टूल से ब्लड जा रहा है, या ऊपर अपर जीआई ट्रैक्ट से ब्लड लॉस हो रहा है, या कुछ रेयर केसेस में अगर मैं बच्चों की बात करूं तो इट मे बी किडनी डिसीज। बिकॉज हम जो भी हमारी बोन मैरो में जहाँ खून बनता है उसके लिए एक बहुत इंपॉर्टेंट हार्मोन है जिसका नाम है एरिथ्रोपोइटिन। वो किडनी से ही सिक्रीट होता है, और किडनी बोन मैरो को स्टिमुलेट करती है, तब वो हमारा ब्लड बनाना शुरू करती है। ऐसे लीवर का भी बड़ा इंपॉर्टेंट रोल है। अगर किसी का लीवर खराब हो रहा है तो लीवर प्रोटीन जनरेट करता है जिससे कि हीमोग्लोबिन बनता है। और जितनी हमारी पुरानी लंबी बीमारियां हैं, क्रोनिक बीमारियां, सबके अंदर हीमोग्लोबिन कम हो जाता है। तो एक हीमोग्लोबिन से एक हमें बहुत बढ़िया हिंट मिलता है, देयर इज समथिंग गोइंग रॉन्ग इनटू द बॉडी। इफ यू आर हैविंग एनफ डाइट और योर डाइट हैज रिड्यूस, जैसे कि आजकल सब पेरेंट का कंसर्न रहता है मेरा बच्चा खाता नहीं है। और अगर आप इन जनरल एक सर्वे करें पॉपुलेशन में 6 to 12 मंथ और 1 to 2 ईयर, उन सभी के हीमोग्लोबिन आपको कम मिलेंगे। तो दैट इज द वन मोस्ट pertinent reason for iron deficiency, and that causes loss of appetite and lot of pallor। बच्चा फीका फीका लगता है। तो एंड हीमोग्लोबिन इसके अलावा जो कलरफुल और लाल या सफ़ेद दिखना है, पीला दिखना है, उसके अलावा हीमोग्लोबिन का जो मोस्ट इम्पॉर्टेंट काम है ऑक्सीजन कैरी करने का टिश्यूज में। अब आप हीमोग्लोबिन को ऐसे समझ सकते हैं, अगर एक बस 50 सीटर है तो वो 50 पैसेंजर ले जा सकती है। तो हमारी जो बॉडी है वो 15 सीटर है, 15 सीट वाली है, जिसके अंदर 15 ग्राम अगर हीमोग्लोबिन है तो वो एक फुल्ली सैचुरेट हो जाएगा और ऑक्सीजन को डिफरेंट ऑर्गन्स तक सप्लाई कर पाएगा। अगर हम शॉक कहते हैं, अगर कोई मरीज सीरियस हो जाता है, शॉक की डेफिनेशन भी है कि जो डिफरेंट टिश्यूज हैं, हमारे डिफरेंट ऑर्गन है, वहां पर ऑक्सीजनेटेड ब्लड नहीं पहुंच रहा, ऑक्सीजन नहीं पहुंच रही है। तो हीमोग्लोबिन इतना इम्पॉर्टेंट है हमारी हेल्थ के लिए, हमारी जनरल वेलबींग के लिए। और जो बच्चे पढ़ने में, कुछ बच्चों की कॉग्निशन खराब हो जाती है, उन्हें पढ़ा लिखा याद नहीं रहता, फोकस सही नहीं कर पाते, वहाँ भी आपका हीमोग्लोबिन बहुत इंपॉर्टेंट है। We are very lucky. We are having today on board Dr. Palash, who is a senior hemato-oncologist, and we will be talking about common question about nutritional anemia and loss of appetite result. I'm sorry. Good evening, ma'am.
Good evening, sir.
Welcome on board. How do I know if my child is having less blood or my child is looking pale?
So, जैसे सर आपने बताया है वैसे ही the child doesn't look pink, or sometimes what we do is what we clinically see is we compare our hands with that of the child's hand, and we see that the child's hand starts looking whitish compared to our hand which looks reddish. या फिर क्लिनिकली पेशेंट क्या होता है कि थक जाता है जल्दी, एपेटाइट खराब रहता है, पेल पेल दिखता है, आपके आईज के नीचे वो पेलनेस आ जाता है. तो इससे हम सस्पेक्ट कर सकते हैं, but to prove it, sir, we need to do some tests so that we can prove that there is anemia. So if you permit me, can I show some slides?
Sure, ma'am. Please carry on.
So जैसे मैं बता रही थी कि this picture shows actually कैसे हम लोग जान सकते हैं कि बच्चे के बॉडी में खून कम है या फिर there is anemia. Here we are comparing the hand of the examiner who is said to have a normal hemoglobin with that of the child, and we see that the child's hands look very white, and this is one of the very surest way of seeing whether the child is having anemia. Otherwise your doctor will also examine the lower part of eye or the mouth, which can also show that the child is having less blood or anemia.
Ma'am, what all tests should I get done to rule out anemia or to find out the cause of anemia?
So बहुत बार ऐसा होता है कि when parents suspect कि there is anemia, they do a hemoglobin test and go to the doctor. But doing a hemoglobin test is never enough, क्योंकि उससे खाली पता चलेगा कि anemia है कि नहीं. और any child, any age, if the hemoglobin is less than 11, it is anemia. But we have to not just find out कि the child is having anemia or not, we have to find out the cause of anemia to treat it. जैसे आपने you said very correctly that most of our patients have anemia due to iron deficiency. Iron की कमी की वजह से सबसे ज्यादा common होता है anemia, but there are many other causes. For example, B12 deficiency, vitamin B12 की deficiency, folic acid की deficiency, या फिर some other critical cases also, some difficult cases, some genetic causes like thalassemia, sickle cell anemias, and some dangerous conditions also. So anemia can be because of a many number of reasons, and to find out why anemia is there, at least we need to have a complete hemogram. Complete hemogram should at least contain hemoglobin Paxil volume, MCV or a mean corpuscular volume, and a RDW, that is the difference between the smallest and the largest RBC. So reticulocyte count, these are some certain parameters which will help the doctor decide on what is the cause of anemia, whether it is something related to nutritional deficiency or whether there is some dangerous cause lying inside. So at least I would need a complete hemogram, and a complete hemogram would guide me into knowing what is the cause and managing accordingly.
When do I need to see a doctor?
So ideally, any child with anemia should be seen by a qualified doctor, because though it is correct that iron deficiency is the most common cause, but again, in children, we need to be very sure that we are not missing out in some dangerous condition. Again, if your child is having severe symptoms, सांस लेने में तकलीफ हो रही है, बिल्कुल खाना नहीं खा रहा है, child is not active at all, in those conditions definitely you need to visit a doctor. But ideally any child who is having pallor, who is जो कि pale दिख रहा है, that has to be evaluated by a physician.
मैम, अगर किसी का हीमोग्लोबिन कम है तो क्या क्या सिम्टम्स आएंगे उनके अंदर
So
में जो शायद उन्हें पता भी नहीं होता, क्योंकि मेरे पास बहुत पेरेंट्स आते हैं, उन्हें ये नहीं मालूम होता उनके बच्चे का हीमोग्लोबिन कम है, क्योंकि वो सुबह शाम उस बच्चे को देख रहे होते हैं, तो दे कांट ऑब्जर्व इट. जैसे कि आपने वो स्लाइड दिखाई, अपने हाथ से आप अपने बच्चे के हाथ मिला के देखिए कि किसका ज्यादा लाल सुरख है या हु इज मोर रेड, देन यू कैन फाइंड आउट योर चाइल्ड इज पेल. तो क्या क्या सिम्टम्स क्या क्या होंगे जिनका हीमोग्लोबिन कम होगा?
So usually जब हमें पेशेंट्स को अनीमिया होता है, first thing most commonly they stop eating, they don't eat well, they're very irritable. Some children they start biting, then they'll be unusually irritable without any reason. They'll be cranky all throughout the day. As hemoglobin falls further lower down, child starts breathing faster, थोड़ा सा खेलने से थक जाएगा और fatigability, easy fatigue हो जाएगा. Sometimes it happens that child becomes very, when the hemoglobin levels fall very fast or it becomes very low, then the child may even have very fast breathing and may not be comfortable at all. Sometimes even when there is iron deficiency, there may not be much of anemia, but there will be other problems. For example, there will be learning disability, memory loss, very difficulty in adjusting with classmates or in school. So there might be some children have restless leg syndrome. That is, at night they will be having lot of movements of the legs. So many other symptoms are there, but these are the common symptoms जो होने से you may suspect that the child might be having low hemoglobin.
Okay. So how can I ensure my kid doesn't develop anemia?
So basically, when I want to prevent anemia in my child, so it has to be a balanced diet and proper supplements when required. For example, all babies जो कि ठीक टाइम में बर्थ हुआ है and are on breastfeeding, they have to be given iron supplements in infancy. Usually we start it at 3 to 6 months of age and we continue for 3 to 4 months for all babies. So that actually takes care of the iron deficiency which otherwise the child would develop because of the rapid growth. Baby is born of around 3 kg, becomes 9 to 10 kg by 1 year. So to compensate that, we require to have good amount of iron which cannot be provided just by milk. Once the baby is weaned off, then जब complementary feeding हम start करते हैं and we start giving them food apart from milk, that time we have to ensure that the child is on a complete diet, on a balanced diet, which has got a good amount of iron-rich food, as we saw in the previous slide. Green leafy vegetables, soya bean, these are very, even ragi, these are very rich and good sources of iron. Apart from that, non-vegetarian food, liver, chicken, these are very good sources of iron. If mother can cook in a iron vessel, etc. So these are some methods by which we can ensure that the child gets good amount of iron. Again, it has to be a balanced diet because only iron deficiency isn't prevalent, as sir must be seeing in his experience that now B12 deficiency is also being seen. So again, a diet which is very balanced, has a good amount of all nutrients will help, will go a very long way in preventing iron deficiency. Again, many children, especially toddlers, are very fussy eaters and they love junk food and they love milk. So many parents, they give a food which is dominant in milk. So I would suggest having a milk somewhere around 400 to 500 ml per day of cow's milk. Would again, because milk is not a very good source of iron and the milk iron is not much available. So these are some methods by which we can ensure that our child doesn't develop nutritional deficiencies.
And before 1 year of age, either it should be mother's milk or enriched cow's milk formula, not cow's milk, because there are people those who think we have our own cow and we are giving pure milk to the cow, to the child. It is cow's milk is for their calves, not for our children. So that is why it is fortified and they are converted into the formulas. All and top of that breast milk from 1 to 10 number. This is breast milk, and if you don't have breast milk by you do not have availability of breast milk, then you should shift on the enriched cow's milk formula. जो बच्चे बोवाइन मिल्क पीते हैं उनमें आयरन की डेफिशिएंसी काफ़ी कॉमन है, और स्पेशली जो काउज मिल्क पीते हैं उनमें कुछ बच्चों के अंदर ऑकाल्ट ब्लड लॉस रहता है, इंटेस्टाइन से ब्लड का लॉस रहता है, जिससे उनका हीमोग्लोबिन और ड्रॉप कर जाता है. आजकल हम विटामिन B12 डेफिशिएंसी भी बहुत देख रहे हैं. पहले शायद हम इतने टेस्ट नहीं कराते थे, बट अब हम काफ़ी विटामिन B12 डेफिशिएंसी हमें देखने को मिलती है. पहले एक इन्फेंटाइल ट्रेमर सिंड्रोम होता था जब 20-25 साल पहले, जब सिर्फ उसमें विटामिन B12 डेफिशिएंसी मिलती थी जो एक्सक्लूसिवली ब्रेस्ट फेड थे. बट अब इन जनरल सभी लोगों में विटामिन B12 डेफिशिएंसी मिल रही है. या तो जो इंट्रिंसिक फैक्टर एक जीआई के अंदर पेट के अंदर एक इंट्रिंसिक फैक्टर होता है जो विटामिन B12 को एब्जॉर्ब कराता है, वो शॉर्ट हो गया है, या हमारी डाइट में विटामिन B12 नहीं है। विटामिन जो वेजिटेरियन है उनके लिए जो विटामिन B12 का जो मेन सोर्स है वो कच्चा दूध है। कच्चा दूध अब कोई पीता नहीं है, सब बॉयल करके पीते हैं। आयरन डेफिशिएंसी का एक कारण ये भी है कि पहले आयरन यूटेंसिल यूज होते थे, अब वो यूज होने बंद हो गए हैं, तो पहले इतना आयरन डेफिशिएंसी एनीमिया नहीं होता था। तो कैन इट बी ए थैलेसीमिया?
So yes, when a child develops anemia, especially in the first 2 years of life, we are very concerned about it being thalassemia major and later on thalassemia intermedia. So usually in these children, there might be a family history of some relative, first degree relative being having thalassemia major. There might be parents who have been tested for thalassemia prior to pregnancy or during pregnancy and are thalassemia traits. So in these children, there is chances of thalassemia, but that has to be seen by a physician clinically, क्योंकि इन बच्चों में apart from anemia उसके साथ liver बढ़ जाता है, spleen बढ़ जाता है, so that has to be clinically seen, and only after being seen clinically and with ancillary test, we can say whether thalassemia is there or not. But again, thalassemia is quite prevalent. The incidence is somewhere around of trait is around 3 to 5%. And when two parents who are thalassemia trait and they have a baby, there is a 25% chance of the child having thalassemia major.
There are certain diseases which are particular, which are predominant in certain castes, like thalassemia is very common in Punjabi Brahmins. There's one more disease which is very important for anemia. We all should know is celiac disease. That is again very common in North India, and that is a sensitivity to the gluten. Gluten is one protein that is present in the wheat, and there are few people those who are sensitive to gluten, and they that gluten damage their intestinal surface, and they can't absorb iron and other vitamins, so they develop severe anemia or stunted growth. So celiac disease is also very common in our belt. Are iron supplements necessary?
All children who are being breastfed should ideally be given iron supplements in the first 1 year of life. Now, as per the government guidelines, all children get iron from their Anganwadis twice weekly at least. And again, if the child is on not on adequately fortified cow's milk formula, then again we have to give supplements to all children.
Um, Please tell us more about iron supplement. There is a lot of intolerance with iron. There are few children, those who develop diarrhea, those there are few children, those who develop constipation, and there is staining of teeth also with iron. So, what all precaution we should take when we start iron? Should we take iron daily or should we take once in a week? What are the protocols to start iron syrup, and how we should decide, and how should we continue, and how long we should continue?
So ideally, when a patient is having iron deficiency, we start on iron dose somewhere around 5 to 6 milligram per kg. When we start it in a younger child as a prophylactic to prevent iron deficiency, we give it at a lower dose. Now, iron should ideally be given in one single dose. Best is to give it empty stomach. But as sir very correctly said and must have seen in his practice, that most of the patients will develop either constipation or diarrhea or staining of teeth. And these are the main complaints because of which parents stop giving iron. So in these cases, I think giving it in between meals also works fine. Again, if your child is not tolerating a particular formula, a particular syrup, you can go to your physician and get for other formulations of iron can be tried. Like there are some formulations which have lesser GI complications. And again, once iron deficiency has been diagnosed, it has to be given at least for 6 months. That is because जब iron deficiency होता है तो first the stores in the blood get depleted. After that, it goes into a iron deficient hematopoiesis, या फिर blood production. And third phase is the phase in which anemia develops. But the patient can develop symptoms even in the phase where anemia is not there, especially this cognitive effects, child having learning disorders. These all develop in mainly in the iron deficient phase. Not in these children may not be even having anemia; they might be just having normal or very low or low normal hemoglobin levels. So in this case, we need to give at least for 6 months so that the stores are also replenished. And apart from supplements, we have to ensure that in diet, the iron, जैसे sir ने बोला कि cook in a iron vessel, then try to incorporate iron-rich food in everyday diet to ensure that the plate contains iron-rich food so that these micronutrient deficiencies can be avoided.
राइट. आप आयरन के साथ तो जो सबसे इम्पोर्टेंट बात है, जो जंक फूड है वो सबसे ज़्यादा डैमेजिंग है, एंड दैट लुक्स टेस्टियर बट दैट इज़ नॉट गुड फॉर आवर हेल्थ, एंड वी ऑल कीप सेइंग दैट, बट आई डोंट थिंक एनीबॉडी टेक इट डैम ऑफ. सब अभी भी वही खाना चाहते हैं, और बच्चों को वो ये सोचते हैं अगर इसने कुछ नहीं खाया तो चलो यही खिला दें. But this is a misconcept, and you should stop giving wrong food to your child. Maybe आज नहीं खाएगा, कल नहीं खाएगा, परसों नहीं खाएगा. This is basically a storage body, and he will start eating because भूख लगना उसकी उसकी भी बहुत ज़रूरत है. और धीरे धीरे अगर वो नहीं खाएगा तो उसकी एनर्जी डाउन हो जाएगी और वो खाना शुरू कर देगा. बट अदरवाइज यू इफ यू कीप फोर्सिंग देम और यू आर गिविंग सब्स्टिट्यूट टू देम, दे विल नेवर ईट. तो मैम कितने बहुत ज़्यादा लोगों को मैंने देखा है वो जब उनके बच्चों का हीमोग्लोबिन कम निकलता है तो वो ब्लड चढ़ाने के लिए कहने लगते हैं. इवन कुछ डॉक्टर भी उनको ब्लड चढ़ा देते हैं. एंड मैंने बहुत बार देखा है कि ब्लड चढ़ाने से पहले उसका कारण जानने की तरफ कोई कोशिश नहीं होती कि इतना हीमोग्लोबिन क्यों ड्रॉप कर गया. एंड फिर उन बच्चों का कई बार अक्सर दोबारा से ब्लड कम हो जाता है, और कुछ बच्चों में तो ब्लड कैंसर भी निकलता है. तो क्या ब्लड चढ़ाना इसका उचित इलाज है, या व्हाट शुड वी डू, एंड कितना
So,
हम कर सकते हैं, कितने आयरन तक हम वेट कर सकते हैं ब्लड ना चढ़ा.
so iron deficiency या कोई भी न्यूट्रिशनल एनीमिया में we should ideally wait. In fact, blood transfusion का प्रिंसिपल ये है कि if there is any other method जिससे ब्लड बढ़ जाएगा, then try to avoid blood transfusion until and unless the child is sick. अगर बच्चा सेप्टिसीमिया में है, अगर बच्चे का कार्डियक फेलियर है, ऑक्सीजनेशन कम हो रहा है, in those cases an emergency transfusion may be given. Otherwise, in no case a transfusion should be given without the proper diagnosis of why hemoglobin has fallen down. Many children, even with hemoglobin as low as 3 and 4, they will come walking to OPD with iron deficiency anemia, and they respond wonderfully to the oral iron supplements. Remarkable, like, it works like magic. Like 1 week back, it will be hemoglobin of 3, the child will be irritable, kuch kha nahi raha hoga. You start on supplements, 7 to 14 days after the child comes, happy child, hemoglobin would have risen by around 1, and appetite would have returned back, child's behavior would have improved, irritability kam ho gaya hoga. So when in cases of nutritional deficiency, be it iron deficiency, B12 deficiency, first line should be ideally to give the nutrition supplements, and one should not transfusion should always be treated with lot of caution. Blood is also a drug. We presently screen for few diseases, but we really don't know what all diseases it can cause. So ideally, it should be avoided at least till we don't get a diagnosis. Once we get a diagnosis, if it is a condition, जैसे कि it is thalassemia, in which the bone marrow is affected, वहाँ blood बन ही नहीं पाएगा. In those conditions, we have to give blood. But in conditions like iron deficiency, जिसमें कि आप न्यूट्रिशन सप्लीमेंट्स दे सकते हैं, या फिर सर ने जैसे स्टार्टिंग में बताया कि किडनी डिजीजेस इन विच गिविंग एरिथ्रोपोइटिन, बिकॉज एरिथ्रोपोइटिन इज द हार्मोन और विच विल लीड टू प्रोडक्शन ऑफ आयरन of RBCs in the from the bone marrow. So in those conditions, first trial should be definitely by giving other safer alternatives, and one should not be very मैंने बहुत उतावले नहीं होना चाहिए, ब्लड चढ़ा देंगे बच्चा जल्दी ठीक हो जाएगा, बिकॉज अगेन ब्लड इज it is not to be taken easily. It is a drug which has to be given in very controlled settings.
Okay, and what about iron injection? There is a trend of giving iron injection to children.
So if the child is totally not tolerating iron, or again when we are giving erythropoietin injections, or maybe there is a lot of side effects to iron, those cases we can go for injectable iron. Sometimes child does not respond to oral iron, where we think there might be some problem with absorption of iron. So in those conditions we can go for injectable iron. Injectable iron again given intramuscularly or intravenously, but these are again second line treatment. First we try to manage with oral iron, and in most of the children oral iron works wonders.
My kid is a fussy eater. How to ensure my kids get all the nutrients?
So I think this is the problem of every parent, and probably all the parents who have small children have at some time, as sir said, कि कुछ नहीं खाया चलो सुबह से कुछ नहीं खाया चलो थोड़ा नूडल्स खिला दे, या कुछ नहीं खाया चलो थोड़ा मिल्क दे दे. This happens to the best of us because full day child not eating anything, it is really stressful for the parent. So again, we have to remember that toddlers are fussy eaters. For them, we should look at the weekly intake, and we can give it in a modified form. For example, बच्चे पालक पसंद नहीं करते, but you can make paratha with palak and then the child accepts it. Or maybe your child doesn't like soya, so you can make you could put it in a sandwich and give it. So different forms work very nicely for children. And of course, children learn from example. If I sit in front of the kid and I eat healthy food, I keep on telling ki how everything is important, they start emulating parents. So if I will be eating french fries and cold drinks and asking my kid not to take, it doesn't actually work that way. So in the whole family's diet also has to be taken care of.
Okay. And is iron deficiency dangerous? Does it have any long-term effects?
So iron deficiency is has been associated with many things, starting from long-term cognitive defects, learning disabilities, even infertility in some, as per some studies. So yes, iron deficiency can be dangerous and has to be avoided because this is the growing brain. We want the brain, because iron is a very important nutrient which not only works in hemoglobin synthesis but also in the intracellular enzyme synthesis, for also your of the neurons growth. So at least in the growing years, we should definitely be very cautious and very strict about avoiding iron deficiency. One other symptom I forgot mentioning is pica. Many children who have iron deficiency have this symptom of eating mud or clay or iron or ice. So these symptoms, if your child has, for example, children eat mud. So there are two things which can happen. They also have the risk of developing infestation by various worms. These worms can again lead to bleeding from the GI tract and again worsening iron deficiency, and it in itself might be a feature of iron deficiency. So these are some things which should uh, make the parent cautious that my child might be having some deficiencies.
तो आपने बताया कि जो बच्चों की डिमांड उतनी पूरी करी जाए जितनी जरूरी है और खाने के मामले में कोई कॉम्प्रोमाइज ना करा जाए. जो मैं रिसेंटली सभी पेरेंट्स को जिनके टॉडलर्स हैं जो खाने के लिए फंसी हैं, मैं उनको बोलता हूँ एक आप स्टूल कोने में लगाइए और वहाँ उसका एक फोटोग्राफ, बच्चे का एक लंबा फोटोग्राफ, लॉन्गिट्यूडनल फोटोग्राफ लगा दें जिससे उस कोने को वो अपना समझे और वहाँ आप 2-2 घंटे में उसका फूड रखते रहें और उसको फोर्स ना करें. अगर आपने 11 बजे खाना रखा, उसने नहीं खाया और उसने नहीं छुआ, तो अब नेक्स्ट टाइम आप 2 घंटे का बिल्कुल ऑफ रखें, फिर 1 बजे वहाँ खाना रखें. आप देखेंगे अगर वो भूख धीरे धीरे वो अपना खाने के प्रति आकर्षित हो जाएगा. और आप बिल्कुल भी उसे खाना खाते हुए ना देखें, थोड़ा वो गिराएगा भी, थोड़ा उसके कपड़ों पे भी गिर जाएगा, तो डोंट वरी अबाउट दैट. लेट हिम लर्न हाउ टू ईट एंड हाउ मच टू ईट. अगर आप इसमें आदा बने रहेंगे और खुद खिलाने की कोशिश करेंगे तो उसको आयरन डेफिशिएंसी एनीमिया भी होगा और प्रॉब्लम्स भी हो जाएंगी. और बच्चों को खाना खिलाना सिर्फ खाना खिलाना नहीं है, उन्हें अपना उनके ऊपर अपना कंट्रोल लेना है. आपके आपके ऊपर बच्चा आपकी बात तभी समझेगा जब वो अपनी मर्जी से खाना खाने लगेगा. तो सब पेरेंट्स का यही मेजर कंसर्न रहता है कि ये खा नहीं रहा और बड़े मायूस हो जाते हैं इस बात के लिए कि बच्चे ने अभी 1 घंटा हो गया कुछ नहीं खाया. इवन आजकल ऑपरेशन के बाद भी कहते हैं कि कब खाना दें. सुबह ऑपरेशन होगा, 1 घंटे बाद पूछेंगे कब खाना दें. ये एक बड़ा फैसिनेशन है बच्चों की ग्रोथ को लेके और ये एक एक्सट्रीम में जा रहा है. जब बच्चा एडिपोसिटी रिबाउंड होती है 7-8 साल का होता है तो बच्चे ओबीज हो जाते हैं और ओबीज बच्चे अगेन आयरन डेफिशिएंसी हो जाती है उनमें. ओबीज बच्चों में बहुत आयरन डेफिशिएंसी कॉमन है. जो हम टेस्ट कराते हैं, जो सीबीसी या हीमोग्राम कराते हैं, उसमें एमसीवी, एमसीएससी, आरडीडब्ल्यूसीवी, ये सब बड़े इंपॉर्टेंट टेस्ट हैं जिसके आधार पे डॉक्टर आपके बारे में डिसीजन लेता है. तो इट्स नॉट ए ब्लाइंड गेम. आप अपना टेस्ट कराते हैं और आरडीडब्ल्यूसीवी एक इतना इंपॉर्टेंट टेस्ट है जो अगर आपके शरीर में कोई भी इन्फ्लेमेशन हो रहा है, डेवलप हो रहा है, तो वो आपकी खराब होने से पहले ही, आपको जब डिसीज मैनिफेस्ट करेगी उससे पहले, इवन कार्डिक डिसऑर्डर में भी अगर आपके हार्ट में डैमेज होने वाला है तो आरडीडब्ल्यू आपका खराब हो जाएगा. तो ये टेस्ट इतने वाइटल हैं जो डॉक्टर ही समझ सकते हैं, और एज वाइज उनकी जो वैल्यूज हैं वो चेंज होती रहती हैं। तो आप उन रिपोर्ट्स को खुद समझने की कोशिश ना करें, अपने डॉक्टर पर ट्रस्ट करें, अपने डॉक्टर से जाएं, उससे मिलें और उसको डिसीजन लेने दें। और कई बार ये होता है कि आप डॉक्टर से इतनी कंप्लेंट करते हैं कि उसका पर्चा ही भर जाता है दवाई लिखते लिखते। एंड उसमें जो मोस्ट इम्पॉर्टेंट दवाई है, सपोज अगर किसी बच्चे को भूख नहीं लग रही, आपने उसमें टॉनिक भी लिखवा लिया और बहुत सारी चीज़ें लिखवा ली, फिर एक स्किन कंडीशन की दवाई भी लिखवा ली और कुछ हेयर्स के लिए भी लिखवा लिया, तो पता चला 7-8 दवाई उसमें हो गई। एंड मोस्ट इम्पॉर्टेंट आयरन है जो आपने उस बच्चे को दिया तो उसने किसी कारण नहीं लिया, या उसके दांत स्टेन हो गए, तो आपने वही दवाई सबसे पहले बंद कर दी। तो दिस इज ए रॉन्ग थिंग। अगर आपको डॉक्टर से जो भी दवाई आपने लिखवाई है और वो आपका बच्चा नहीं ले पा रहा है, तो आप अपना पर्चा लेके डॉक्टर के पास जाइए, उससे डिस्कस कीजिए, या तो डॉक्टर उस दवाई को चेंज करेंगे या आपको लेना सिखाएंगे। क्योंकि जो टेस्ट है वो इम्पॉर्टेंट है, जीभ के आगे आधे हिस्से पे टेस्ट ज़्यादा होता है, पीछे कोई टेस्ट नहीं होता। तो दवाई को थोड़ी मात्रा में आप पीछे भी दे सकते हैं। तो ऐसे बहुत सारे मिथ और बिलीफ हम बना लेते हैं अपने बच्चों को ट्रीट करते हुए, जिससे उनके अंदर जो डेफिशिएंसी है, जैसा कि दीपमान ने बताया, बटरफ्लाई इफेक्ट, आयरन का बहुत सीवियर बटरफ्लाई इफेक्ट है। अगर आपके बच्चे में आयरन डेफिशिएंसी हो रही है तो उसकी ग्रोथ पे, उसकी समझ बुद्धि पे, उसकी भूख पे, उसके कलर पे, उसकी सुंदरता पे, उसकी एनर्जी लेवल्स पे, सब पे फर्क पड़ जाएगा। तो न्यूट्रिशन बहुत इम्पॉर्टेंट है, इसको इग्नोर मत कीजिए। और इसमें इमोशनल होने की कोई ज़रूरत नहीं है कि अगर आपके बच्चे ने अगर खाना नहीं खाया है तो उसको आप राइट फूड ही ऑफर कीजिए, रॉन्ग फूड ऑफर मत कीजिए। फर्स्ट ऑफ ऑल यू हैव टू से नो टू योर सेल्फ एंड देन टू योर चाइल्ड। नो कहना सीखिए, जहां आपको नो कहना है वहाँ नो कहिए। दीपमान जी, कुछ क्वेश्चंस हैं अगर आपके पास मैम के लिए, तो प्लीज आप पूछिए।
Sure. Thank you, Dr. Palash, and thank you, Dr. Anuj sir. Um, we have few questions, and for all our attendees, today is World Brain Day, and we have been discussing about the deficiency of iron. Now, all of us should also know there are very beautiful facts about our own brain. We always try to give some piece of information which are very, very interesting. Please do share it with the children. They should also know. So the human brain consists of millions and millions of electoral wires, which are known as axons. I'll come to the question. There are a few questions we are already having, and maybe if you have some more, please post it. So the distance is the equivalent of traveling around the Earth 4 times in a row. So it's a thought that about the 80 billion neurons within the human brain, there are about 10 trillion of connections between this neuron, which helps them to read, write, watch, learn, plan, think. There are so many cognitive functions. And today we have been discussing about the role and importance of various nutrition, and precisely with iron. So it is very important for our cognitive health. And we can go to the first question. Dr. Palash, this is from a 12-year-old Ayush. Ayush is also watching us. So please, should we take this question? If you can go through it. So hello, so my name is Ayush and I'm currently 12 years old. In April, I was infected with GBS and currently my physiotherapy is going on. So what meals should I take to do my recovering fast? Probably some input if you can give to Ayush.
Should I answer?
Yes, sir, sure.
Yeah. Ayush, you are from Meerut, I suppose. And GBS, it takes its own time. The only thing you need is courage to fight this disease. And you should put lot of effort. आपकी इच्छा शक्ति आपको बहुत जल्दी ठीक कराएगी, and try to take balanced diet. आप balanced diet पे, आयुष I think is the only child to his parents, and थोड़ा एफर्ट्स ज़्यादा डालना होगा आयुष आपको, और आप बहुत जल्दी ठीक हो जाएंगे। आपके ब्लड बहुत दिन से टेस्ट भी नहीं हुआ होगा, आप एक हीमोग्राम टेस्ट कराइए। अगर आपका आयरन या और कोई इंडिसेस खराब हैं या विटामिन B12 लेवल लो है, तो वो आपका करेक्ट करके आपको बहुत जल्दी ठीक करा जा सकता है। डॉक्टर पलाश, कुछ आपसे देना चाहेंगे एडवाइस में?
आई थिंक सर आपने तो सभी बोल दिया, बट वही है कि यू हैव टू हैव अ बैलेंस डाइट। आपके बॉडी के हिसाब से, आपके एज के हिसाब से, आपके वेट के हिसाब से जितना कैलोरीज लेना चाहिए वो आप फुल डे में यू हैव टू डिवाइड इट इनटू 3 major meals and 2 snacks. It should carbohydrate, protein, fat सबका सही मात्रा होना चाहिए. Proper amount of roughage होना चाहिए diet में, क्योंकि now you are recovering from GBS, you need to work, you have to have a high roughage in your diet, and of course all the micronutrients, and best to get all the micronutrients from all the colored vegetables and fruits. So have a balanced diet, go work on your physiotherapy, you will be fine very soon.
Thank you, Dr. Palash. Thank you, Doctor. There is a question from Mr. Manoj. He's blessed with a baby girl who is 3 months premature and delivered with the 6 months of pregnancy. During hospitalization, 2 times blood has been infused owing to low hemoglobin level. That's once 5.2 and next was 7.4. And there are multiple questions he's having. Is there a chance of having anemia? Second, after discharge from the hospital, many times they are seeing the lower part of food becoming purple in color when kept in AC. What is this about, and whether it is an indication of low blood level or iron deficiency? And what is the minimum hemoglobin level of the baby of a 4 to 7 months old?
First you answer, ma'am, first you answer for the 4 to 7 months, rest of the answer I will give.
So basically, premature babies, they are more prone to have anemia, because most of the iron stores from the mother to the baby goes after 28 weeks. So premature baby are first very prone to having having anemia. That's called anemia of prematurity. Second, they undergo a lot of blood tests. A baby has very less amount of blood so repeated blood tests the baby has to undergo in NICU. So again, that is a corroborative factor. Lots of other things lead to bone marrow suppression. So these babies are prone. At no time the hemoglobin in premature baby we tolerate up to 7 to 8. But any child having hemoglobin of less than 11, we classify it as 11 as anemia. So if your baby is having hemoglobin less than 11, definitely baby is having anemia. But we will tolerate a hemoglobin of around 8 to 9, but we have to at least supplement with iron for this baby.
Mr. Manoj, your child has suffered from anemia of prematurity, and for that he has been transfused with packed RBC. And right now, the bluishness of the lower limb in AC is because of the cold temperature. This is vasoconstriction which is causing bluishness of the limb. It is not because of anemia. But you have to get his anemia profile and bone profile because both are important. Calcium, phosphorus, and alkaline phosphatase, hemoglobin, lactic count, and PCV. So you have to check it periodically, and you are in very good hand because your child was born at 6 months of age and now he is 4 months of age. So you are already in very good hand. You continue with your doctor and you please consult him periodically whenever he calls you, and you please visit him.
Wonderful, sir. Thank you, Dr. Anuj and Dr. Palash. I believe, Mr. Manoj, these answers are going to be great solace to you. Sir, there is a question from Rakesh Mishra. He's asking, sir, what is the impact of vitamin D associated with anemia?
Vitamin D in general is less with everyone these days because earlier on it was never tested and now it is tested and it is very less because of the concrete jungle also and altitude also. And if you have low iron, low vitamin D, maybe you may be having celiac disease or some malabsorption. Malabsorption is one condition where absorption of the various vitamin and minerals are not happening into your body. There is one more disease which is known as inflammatory bowel disease. There also you may have anemia or different vitamin deficiency. Even folic acid is also a vitamin. This is B9. This is also known as B9 vitamin. So there are various vitamins which get absorbed into the small intestine. There are fat-soluble vitamins which are absorbed A, D, E, K through bile. So there could be anything. And when one will see or examine the child, and he can make out what is the reason and how far they should go for the investigation.
Thank you. Now, there is a couple of questions from Chetan Kashyap. No, there is a question from Deepti Singh. She is asking, my son is 8-year-old. His palm seems white. Sometimes his behavior is so irritating, like anger, shout without reason. Does not concentrate in his work. Sometimes he does not take his food properly. Is he suffering from iron deficiency?
So can I take the question?
Yeah, sure.
Yes, ma'am.
So I think, like as you said, your child's hand looks pale, and you feel that your child is very irritable. He's not having a good appetite. So there is nothing wrong in getting him tested. Please go for a complete hemogram. Look at the hemoglobin levels, and if it is less than 11, please meet a physician so that they can guide on whether there is anemia or not, and whether supplementing with iron would help him or not. So I think you should get your kids' blood test being done, and then meet your local pediatrician or physician.
Thank you, doctor. There's a question from Chetan Kashyap asking is what balanced diet should a child take? Please, I think this has to be age specific. Please mention that. And which fruit, grain, and drink should a child take for health and growth of a child? Sir, can I say, Chetanji, and all the attendees, we have been sharing with you. Please visit to I'm the Best Mom. There you have this beautiful book written by Dr. Anuj Rastogi called I'm the Best Mom. So this is a handbook for every mom. And eating habits, you can see growth and developmental role, and how it is going to be a great handbook to you for with a vital insight. So please download it. It's available at the website of imthebestmom.com under the motherhood section. Please browse through. It's going to be a lot of help for your questions. A lot of detailed information, a lot of recipes you will also get while addressing to kids' demand at times on different type of food, but nutritious and delicious. Sir, there is a question. My daughter is 6-year-old, but only 16 kg, 16.4 kg. She has minor thalassemia trait. Any dietary change is required?
Dr. Palash, will you answer? Right.
So basically, thalassemia trait, we do not need to change the diet. Even these kids are also sometimes prone to iron deficiency. Many times we feel that they are not, since they have thalassemia trait, the hemoglobin levels are low, so they may not have iron deficiency because the body absorbs a lot of iron, but it is not true. In practice, we find some children do have iron deficiency as well. However, for the weight, I would need some more information, just like how has been her growth, whether she has been following her growth curves or not, what is her height, how was her, like what is her change in weight. So I think with that information only we can go into more details on whether we have to do anything about her weight.
Right.
And you have to take care of his groom also in time to come, because if both of them are thalassemia trait, there are more chances of have thalassemia major or intermediate in their children. So अगर आपके बच्चे को थैलेसीमिया ट्रेट है, तो जब भी आप उसका शादी का टाइम होगा, तो उसका जो पार्टनर है उसका आपको जन्म पत्री दिखाने के अलावा उसका हीमोग्लोबिन लैक्टोफॉरेसिस जरूर होना चाहिए। अगर दोनों में थैलेसीमिया ट्रेट होगा, तो वो बच्चा जो उनका बच्चा होगा वो थैलेसीमिया मेजर हो सकता है।
Thank you, Doctor. Sir, this is a question for you, Dr. Rastogi. Another issue with the same Mr. Manoj is writing. We are facing during this time, our baby, while trying to be louder and creating sound, her sound is pressed as if like that of a laryngomalacia. My question to Dr. Manoj Rastogi, sir, is it normal at this age or any treatment is required?
I could not understand the question. Kindly repeat it.
The question is, the child is making sound louder and creating sound. A sound is pressed like that of a laryngomalacia.
No, laryngomalacia, children they produce inspiratory stridor, and laryngomalacia improves by its own. If child is growing well, then there is no treatment required. Only thing, you have to keep child little upright, and in certain position they produce sound. And if a child is not thriving, then he needs a little surgery and to improve laryngomalacia.
Okay. So I think that's a lot of answer from Dr. Anuj Rastogi, sir, to Mr. Manoj. Sir, this is a question, but we are not able to take it because something not able to make out. This is a half question. So we can go ahead with the like overall, when we are talking about starting from the child who is a ICU graduate or maybe at an infant stage or maybe growing up as an adult. And there are so many micronutrients, nutrients, and the kind of food habit we are having. Everybody is concerned about are we eating right? Is our immune system is perfectly fine or not? So there are so many immunoboosters are available today. Any advice, because we are also going through unprecedented time and everybody want to be very healthy and they believe this thing are going to have a very quick action on our body. Dr. Palash or Dr. Anil, sir, any message to our audience?
First of all, proper hand hygiene, proper vaccination, and balanced diet. Like our diet is deficient of iron, vitamin B12, and omega-3 fatty acid. So these are the supplement which we should incorporate into our diet, and taking care of the hygiene first, maintaining social distancing and necessarily not creating crowd. So this will be helpful to us. And we have seen in proper lockdown there were very few viral illness beside corona. कोरोना तो फैला ही नहीं लॉकडाउन से, और बाकी की वायरलनेस भी खत्म हो गई थी। तो इट इज सजेस्ट कि हम जब ज़्यादा मिलते हैं और प्रॉपर हैंड हाइजीन नहीं रखते हैं या हैंड शेक करते हैं, प्रॉपर हैंड वॉश नहीं करते हैं, तो ये डिसीज स्प्रेड्स होती है।
So I would agree with sir कि like there is no shortcut to immunity. Immunity के लिए you have to have a complete balance. ऐसा नहीं है कि कुछ दवाई ले लिया and immediately the immunity becomes perfect. So it has to be a complete balanced diet, good sleep, proper nutrition, proper exercise, stress free. So all of these go hand in hand in improving the immunity with, of course, vaccines which will boost the immunity to the specific diseases towards which vaccines have been given.
Right. Thank you so much, Dr. Palas, and thank you, Dr. Anuj, sir. Sir, over to you.
Yeah, the doctor of the future will give no medicine, I think so, but will instruct his patient in care of the human frame, in diet and the cause and prevention of disease. This is very well said by Thomas Edison. And thank you very much for the patient listening and joining us for this on this platform. Thank you, Deepmanji. Thank you, Dr. Plash. And we will meet you all next week on Thursday at 7 p.m. Thank you. Thank you very much. Good night.
Thank you so much. Good night.